Hey, hope you're doing fine. My name is Usman Ghani. I'm a licensed physical therapist working in Toronto area. Welcome back to my YouTube channel, Muscle Tone Up with UG. This is a platform where you can find educational and informational videos on various muscle and joint issues. Our today's topic is phase 2 of frozen shoulder or shoulder stiffness, also diagnosed as adhesive capsulitis. In my previous video, we discussed about the first phase of the frozen shoulder, that is the freezing phase, in which pain is the main symptom and we try to maintain as much range of motion as possible. However, I feel most of the patients, when they reach to their healthcare provider, they have already crossed past that phase and they are in the phase where where the main problem is shoulder stiffness and the limitation in shoulder range of motion. So these are these three stages we already discussed in my previous video: freezing, frozen, and thawing stage. Frozen is the second stage, and this is what we'll be focusing on in today's video. The most prominent feature at this stage is stiffness of the shoulder, especially with these movements. One may find it difficult to reach above head or reach to the above head cabinets in the kitchen, or raise the arm and put the hand on the head, or trying to take the wallet out of the pocket of the trouser becomes very difficult. This phase lasts in 2 to 6 months time. The main goal during this phase, of course, remains pain, but the reason of the pain at this time is different because it is mainly due to the tightness and shrinking of the capsule and the tightness of the muscles. So we can use hot and cold pack as needed. Continue with the modifying sleeping posture we discussed in the previous video. People might need to take non-steroidal anti-inflammatory drugs to control pain and to continue with the exercises. And if someone has not tried the steroid injection in the first phase, still there is a chance they can try it. Now, the second main important goal during this phase is to regain the range of motion as much as we can. As this is a long-term condition, it is very important to understand what phases are involved, what are the expectations at each phase, and what we need to do at each phase. That would help to ensure that would help the perseverance and adherence to the treatment plan. So the first thing is the hot pack. So you can take a hot water bottle or a gel hot and cold pack, place a towel around your under the arm, around the shoulder area, and you can place a hot pack over that. Continue doing the hot pack for 10 to 15 minutes before doing the exercises. That would help to relax the muscles and to achieve some flexibility. This hot pack should also be applied around the shoulder as well, that we can see in this picture as well. You can also use a gel hot and cold pack to cover all the areas around the whole shoulder. Keep checking repeatedly and lifting the hot pack up and then reapply it again to avoid burns. You can also watch my detailed video for safe application of hot and cold packs. So for the exercises during the second phase or frozen phase, we continue with the pendulum exercises, but this time you can hold a 1 pound weight or a soda cane or a water bottle in your affected arm. Stand up like this with the affected arm and shoulder hanging freely. And then start shifting the weight on each leg to initiate pendular movements on the affected shoulder. Continue forward and backward oscillations and then side to side oscillations like this for 1 to 2 minutes, couple of times a day. For the next exercise, sit up on a chair like this and with the affected arm's hand, hold the seat from the bottom like this. Keep your elbows straight and lean your trunk to the non-affected side avoid using abrupt or too much stretch. So gently keep the elbow straight, gently lean to the non-affected side, and here you can start giving some gentle oscillations, small gentle oscillations like this. Keep doing it for 10 to 20 reps. For the next one, this exercise we did during the earlier phase as well. We continue with this exercise in this phase too. Sit down just beside the table and put the affected arm on the surface. Slide it forward and scooch the bum back then in the seat. At the end range, stay there for about 5 to 10 seconds to give the stretch to the muscles around the shoulder. Slide the affected arm forward first, like this, and scooching back in the chair. And hold it here for 5 to 10 seconds. Keep doing it for 10 repetitions, a couple of times a day. This is called the wand exercise. For that, you can take a stick in your hands, keep your elbows straight, and try to raise both arms up above your head. Keep taking it as far as it can go. And here you might start feeling the stretch in the affected shoulder. Then you can bend your legs up and try to lift the bum up. That may help to take the hands further a little down. Try to hold the hands at lowest position when you bring the bum down, or just keep trying this exercise. Repeat it 3 to 5 times here. And then straighten the legs and bring the arm down. Repeat it again. Take the hands all the way up as far as they can go, then bend the legs up, and again start repeating the same thing. This way, repeat this whole process for 10 repetitions, a couple of times a day. To help with the shoulder external range of motion, that is the way you might need to hold the wand in your hands. And with the non-affected hand, gently push the affected hand towards the bed surface with the bent elbow, like this. And then for the internal range of motion, hold the wand on the back of your bum and try to raise both hands up along the back. Lower back as far as high as it can go. At the end range, give it a bit of stretch. Hold it there for 5 seconds. Keep repeating it for 10 times. Pulley exercises are very important as well at this phase. So you can set up like this. You can use a waist belt as well above the room door and stabilize the door with your feet. Keep repeating it for 10 to 20 repetitions or for a couple of minutes twice a day. Initially, pull the affected hand with the non-affected hand. But as you can feel that there might be some range of motion achieved, try to raise the affected arm as high as it can go and then apply the stretch with the non-affected hand. You can move forward in the seat when the range of motion improves a bit. While looking from behind, what I have clinically seen is when people try to do the pulley exercises, they tend to lean their trunk to the non-affected side. Try avoiding that. Keep the body and upper trunk straight so that the movement takes place only at the shoulder joint, not at the upper back or at the trunk level. For the next exercise, sit up like this and move the affected shoulder in a clockwise direction. Remember, it should move only at the shoulder joint or shoulder and scapular area. Keep doing it for 10 to 20 repetitions, a couple of times a day. All right, guys, these are a few of the exercises that I have clinically found that may help during this stage. Hopefully, it helps to improve the range of motion at the shoulder. These are the various topics I shall be covering in my future videos. If you want to get them, please consider subscribing the channel and press the bell icon to get the notifications in time. Give me a thumbs up if you like it. Don't forget to share it with family and friends, as sharing is caring. Disclaimer: this is a platform where you can find educational and informational videos on various muscle and joint issues. This information, however, is not meant to replace your individual advice from your healthcare provider. Take care until next time.